Good morning, everyone. I hope you're all doing well today. This is the obvious month to focus on sexual well-being, but our sexual health is important every day of the year, of course. Our sexual function is tied to obviously many different systems within the body, but specifically I want to focus today on our hormone balance and the importance of blood flow. As a normal product of aging, our gonadal hormones start to decline actually relatively early on, probably about the age of 25. This happens in men and in women. In men, that decline is a little bit more gradual than it is in women. In guys, we call that andropause, and as women get closer to the age of 50, we call that perimenopause and then menopause. The importance of having optimal levels of gonadal hormones as it relates to our sexual function is critical. For replacement, we have a lot of safe and effective options, most notably topical hormones, injectable hormones, and then the most popular type of hormone therapy that we do here at Lindgren Functional Medicine are pelleted hormones. The only hormones that are safe to use are what we call bioidentical or natural hormones. And pelleted hormones are natural hormones that are fused or compressed into these tiny tablets that we place underneath the skin that release in a very physiologic fashion over the course of 3 to 4 months. And then they're simply replaced. We do this in men and in women very effectively for restoration of healthy hormone balance. Another critical part of our sexual well-being and our sexual function is blood flow. And that is something that also declines as we age. In men, we have a very effective tool for treating blood flow specifically, and that's a procedure called GAINSWave, which is using a shockwave therapy that's repeated either 6 to 12 times, which is a painless procedure that is extremely effective at naturally restoring blood flow to erectile tissue. We often will combine that with something called platelet-rich plasma or PRP injections in men and also in women in a procedure that we call the O-Shot. And platelet-rich plasma is simply when we take blood from a patient, we spin out the red cells and the white cells so that we can activate the platelets, and then we reintroduce them back into the tissue that we're trying to treat. For women, that is perineal tissue, and for men, that's erectile tissue. It's a painless procedure, but it's highly effective at harnessing our body's natural, reparative, regenerative, wound healing capabilities in order to improve blood flow to those areas of the body and to really maximize our sexual function. If you feel like you need help in getting your sexy back, I encourage you to check out the links below or give us a call here at Lindgren Functional Medicine. Have a great day, everyone. Thanks again for listening. Bye now.